I mean, we just literally had a segment last week about a plastic surgeon charged with murder. There is now another plastic surgeon charged with murder, and this one, man, it's crazy. It's different than the last one, and I think that's what makes this story so shocking because, and we're gonna revisit the story we talked about last week in a minute, but this one is really unusual because he's charged with murder in how he was treating a patient. Not that, the last guy allegedly, killed a guy. This is an incident where
he actually killed them.
Allegedly. This incident is different because this is about a patient who died under their care. And what makes that unusual is you usually would never see, a doctor charged with like crime for that. And the first one that really kind of hit that was a big deal was Dr. Death, Christopher Dunch. You've heard the Dr. Death podcast. So he was a spine surgeon here in Dallas, Texas, and he had some super bad outcomes. People died, paralyzed, and they actually charged him with a crime, which is unusual because you can get charged with malpractice, but that's usually a civil case, not a criminal case. And Dunch is serving a life sentence, in jail for what they pinned on him.
Yeah.
So the San Diego DA is charging a plastic surgeon with the murder. It was initially involuntary manslaughter, and as they looked at the evidence, they increased that to actual murder. And the doctor's name is Carlos Chacon. I think I got a picture of him, Travis. Throw that up there if you would. That's him. Him and I are almost the same age because I looked at when he was going.
Is he from Florida?
He is not from Florida. He's from California. That's a great question, Sarah. Normally you would be right. This time you're not, but don't worry. California. As I said, he initially was charged with involuntary manslaughter, and this is a case that happened, I think, back in 2018. A very nice woman, Megan Espinoza, 36, mother of two, went into cardiac arrest during a breast augmentation. And so right off the bat, I'm reading the data on this, right? And so once again, this is an alleged thing. This guy has not been convicted of anything. This is all news I'm pulling from the police reports and everything, and so we're just going to discuss it. So as I said, this mother, 36-year-old mother of two, went in for a breast augmentation and had cardiac arrest. So right off the bat, I'm alarmed by that. I mean, that should not happen, anything can happen, but statistically, a 36-year-old having a very routine, non-life-threatening case should not go into cardiac arrest. That just, something bad had to have happened. That's not just a random occurrence. So that, immediately when I read that, I was like, this is not good. It gets worse. It just goes from bad to worse to worse to worse and worse. So allegedly, while she was having this cardiac event, he left the OR and went and had consultations with 4 other patients while she was having this medical emergency. This is like in the...
And who was there? His nurses?
A nurse, which is crazy. So they were doing it at a doctor OR, so this is not like a surgery center. This is like an in-office OR kind of setting. It gets even worse. So apparently, allegedly, he refused to call 911 when this lady went into cardiac arrest. They said, okay, she's having a cardiac event. We need to call 911. He's like, no, we don't. And then his staff wanted to call 911, and he said, you cannot call 911. This is, reported allegedly. So 3 hours went by from the time that this cardiac event started before he finally did call 911. 3 hours.
So pretty much he could have saved her life, but he chose not to.
That's what I guess the DA thinks and why they're charging him with murder. It gets even worse. He was using an improperly trained nurse to administer the anesthesia, which all this is alarming. That means that this was not a general anesthesia because the nurse wouldn't be able to do general. So this was like a breast augmentation under local with probably some sedation, maybe IV sedation. I'm going to get to why I think she went into cardiac arrest in a minute. But yeah, that's just crazy. Having someone improperly trained giving anesthesia, that's just nutso. I just couldn't believe it. Apparently he lied to the husband and said that she was doing fine when he called and asked, why is this taking so long? And he was like, oh, she's fine. There's been no problems, And then when he finally called 911, it wasn't said exactly what he told them, but apparently he lied to the 911 operators about what events had happened and they had that recorded, and this is all alleged. This is in the DA's complaints. Now, what's crazy is, when I read this, I was just flabbergasted. Apparently, this guy still has his medical license. California has not pulled his medical license as of yet. I assume that when this new stuff came out that they have to be looking at it. So he was arrested. He's now out on bail. He had a $500,000 bail, which he paid. And then the stipulations that they put on him, no surgery in an unaccredited facility, which is what he was doing. He has to notify patients that he's facing a murder charge. And then also he has to use qualified anesthesia for any cases that he does. Like, what? I mean, that's crazy. I can't believe that he still has his medical license.
So if he sits down with a patient and they are about to do like business or operation,
consult.
Consult.
Yep.
He has to tell them, I did kill somebody and I am on.
That's
right. Yeah.
Yeah, like I'm being investigated for
literally
it.
like a teacher being interviewed and be like, also, I'm a child molester.
Right.
Can I teach kindergarten?
I think immediately you get up like, okay,
Oh my
this
God.
consultation is
Sarah.
over, sir.
Dude, Sarah, that was a slam dunk, man. That was a good one. Wow. I don't know. I can only assume that because he has. Okay, so I don't know this for fact, but
I think if anybody's like, also I'm a murderer, that's when you're like, cool.
Peace out. No, but like I think that
With any conversation.
the possibility of him practicing medicine right now is probably 0% because he has to do it in an accredited facility. And as someone who does do credentialing at a surgery center, if somebody pops in with something crazy like that, then the answer is no. I mean,
to me, it's like obviously this guy lacks any type of empathy and shouldn't
Allegedly.
be allowed. Yeah.
Allegedly
lacks any kind of empathy and shouldn't be allowed to have patience in his like taking care of somebody's life. That is like.
I have to say, all right. So first off,
Ew.
what can we learn from this, right? I mean, we don't just talk about things because they're sensational. We talk about things because what can we learn? What can we teach people, to avoid a similar incident happening to you? And so I want to talk about what can we learn from this. All right, so what do we think happened? All right, so as a doctor, I would guess, and I don't know, but I would guess the most likely reason that she had a cardiac event is because if they weren't giving her anesthesia, they were doing this under local, which means they were using lidocaine or marcaine, and that stuff is toxic at high doses. And as someone who delved into doing local breast augmentations, I've done 2 in my lifetime, which I actually did in a surgery center. I did not do them in an office. I was able to do 2 breast augmentations under local, but there is the concern of people getting too much lidocaine or marcaine. And you know what the toxicity is if you get too much lidocaine? Sarah? What happened to this girl?
Heart attack?
Yes, cardiac arrest. You're right. Very good. Didn't mean to put you on the spot.
I was like, wait, what?
If you get too much
I'm not
lidocaine or marcaine.
ChatGPT, okay?
Huh?
I said I'm not ChatGPT. Okay.
But you're like ChatGPT's little sister.
Oh, sure.
Anyway, I would guess that's what happened. The other explanation could be that she had some sort of aspiration event, like they gave her too much like Valium or something. She regurgitated and aspirated into her lungs, and then that caused her to go into cardiac arrest. Or the other thing might be a pneumothorax, which is where you get a hole in the chest wall, because when you're doing a breast augmentation, you are shaving, right along the chest wall, and theoretically it would be possible to give someone pneumothorax. That would be a super, super rare, almost unheard of type of complication, but it's not impossible. Mm-hmm. But the most likely thing that happened is a anesthetic toxicity, which is one of the reasons you don't do things like this. The other things to learn from this is after I did some research, this guy's not a board certified plastic surgeon. He did do a plastic surgery training program, and actually a very prestigious one at University of California, San Francisco, but he's not board certified. And that
And you don't have to be board certified to be a plastic surgeon?
Yes and no. If you want to practice in a facility, you have to have board certification. And so that's how people practice plastic surgery when they're not plastic surgeons. They do it in their offices, like this guy did. But he was a plastic surgeon, but he didn't get his board certification. But why is that? Why would you not get board certified if you are a real plastic?
You have to take a test.
I mean,
or something?
you have to take 2 tests, and it's very hard.
Maybe he didn't pass him.
Maybe didn't pass. I mean, that's possible. I don't know, but it's weird. I mean, there's no reason in the world if you go to a plastic surgery training program that you don't get board certified.
Yeah, like what would be the purpose of going to that school if not to get certified?
Exactly. Like, and so that's, to me, that's an alarm bell.
It's weird.
Surgery under local anesthesia. I mean, you remember when we did the segment on awake surgery, and I was like, I hate everything about this. This is one of the reasons I hate that. I mean, I don't know. I wasn't there. I would speculate if this was done in a surgery center that this wouldn't have happened. Because you have better monitoring. You have an anesthesiologist. And lastly, surgery in the office. I mean, I'm not a big fan of surgery in offices. It's something I've thought about doing myself, and I've kind of backed away from. And let me tell you why it's important in this scenario, okay? Because let me tell you what happens if I'm in the OR and a patient goes into cardiac arrest in a surgery center, okay? Number one, we have ACLS anesthesiologists that we can start the appropriate treatment, which I don't think was done in this case. I don't know that's not available. But you know what does happen is somebody calls 911. That automatically happens. And if I say no, they say, too bad, we're doing the right thing.
Sucks for you.
Right. There is accountability in a surgery center.
Yeah.
In someone's private office where you own the person, like you're paying, their salary, like you can potentially intimidate someone into not saying
for sure
something. His staff members wanted to call 911 3 hours before it was actually called, and he told them no. In a surgery center, that wouldn't fly.
No.
Like, absolutely would not fly. So I think there are things to learn from this terrible tragedy.
Yeah, don't do, like you've always said, if you go get plastic surgery,
you got to do your research.
It needs to be in, make sure that they
make sure they're board certified. Board certified. I mean, I don't want to say that, surgeries in an office are unsafe.
I mean, I had mine was done in an office.
Yeah.
For sure.
I don't want to say it's unsafe.
That I remember.
There are plenty of doctors out there, board certified plastic surgeons who have office ORs that do great work.
Yeah.
But when you go to an office OR, there is a less layer of regulation that you always have in a surgery center.
Yeah.
And so, if you ask me what is safer to do surgery in a surgery center or office, I mean, I can't lie. I mean, it is safer to do it in a surgery center.
Yeah.
It eliminates some risk, because they have to be credentialed correctly. I mean, they have to be board certified, and there are people there to keep the doctors accountable, and that's not always the case. So it's tragic. I think this guy's in trouble. I mean,
yeah.
If what I read was true, like he's going to go to jail, I think, but I don't know. It's all alleged, so we'll find out. We're going to have to do an update.
I would think.
Crazy stuff, right?